Hello and welcome to the Oakland County Medical Control Authority 2021 EQIP in service. The intent and purpose of this training is to provide you with clear, organized, and detailed information about the 2021 EMS Quality Improvement Program. All OCMCA life support agencies, or LSAs, are responsible for all 2021 EQIP requirements. Contact the OCMCA by email or phone with any questions regarding the information expressed in this video. Completion of this video does not provide EMS continuing education credits. However, OCMCA EMS providers can earn EMS CEs for completion of the same video module at americancme.com. To do this, go to americancme.com and log into your account. Then, you'll be taken to your dashboard. Click on the 2021 EQIP in service for OCMCA Life Support Agencies course. Complete the entire video, the post-course quiz, and a survey, and boom, 0.5 EMS CEs in the preparatory category. By the conclusion of this video, you will be able to provide an overview of the 2021 EQIP plan, as well as list and describe all data reporting, education, and knowledge assessment requirements. The spectrum of EMS styles, organizational structures, and response methods in this country is vast. In addition, our system faces a unique set of conditions, such as the specific geographic area, the citizen demographics, the number and level of EMS personnel, the number of hospitals, and the distance between citizens and hospitals. Therefore, there's so much truth behind the old saying, if you've seen one EMS system, you've seen one EMS system. This sentiment couldn't be truer in the state of Michigan. Our state EMS office communicates with the various EMS systems, agencies, and providers by way of a medical control authority, or MCA. An MCA is a quasi-governmental body that maintains EMS standards, regulations, and protocols within a defined geographic area. Per the state law, an MCA is funded by all the hospitals within the defined area that receive EMS patients. Currently, there are 59 MCAs throughout the state of Michigan. In a bit of an oversimplification, the job of an MCA is to coordinate the EMS system and establish written care protocols for its EMS agencies, as well as ensure everyone, including physicians, hospital staff, and EMS, are educated on the protocols. The OCMCA represents all Oakland County, Michigan, and includes 50 life support agencies and 15 hospitals. Many MCAs are just one county in size, like ours. The Detroit East Medical Control Authority, or DEMCA, is just one piece of a county. DEMCA encompasses the city of Detroit and a few of the smaller communities that surround it. There are also multi-county MCAs, such as Tri-County MCA that presides over Clinton, Eaton, and Ingham counties in mid-Michigan. Not all MCAs look and operate the same way, but their essential functions, roles, and responsibilities remain the same. The OCMCA was established in 1995. Since then, there have been many advances and improvements in our ever-growing system. Our vision is a community where every patient receives exemplary EMS care. To bring our vision into reality, the Oakland County Medical Control Authority strives for a progressive, coordinated, and collaborative system delivering quality pre-hospital emergency care while providing state-of-the-art comprehensive readiness, effectively partnering with our neighboring systems. As we said earlier, the primary function of the OCMCA is to coordinate the EMS system and establish written care protocols for its EMS agencies and hospitals, and make sure everyone is on the same page. This includes providing the necessary education and resources to facilitate protocol implementation and/or compliance. To make this process easy, the OCMCA EMS Protocol app continues to improve and assure that every EMS provider has free 24/7 access to the most recent protocols. In addition, like all MCAs, the OCMCA is responsible for collecting, measuring, and evaluating data from a spectrum of sources for the purpose of quality assurance and quality improvement, or QA/QI. All OCMCA operations are formulated through a strategic planning process. The OCMCA develops a 2-year strategic plan that is approved by the Board of Directors prior to implementation. The primary objectives of the 2020 and 2021 OCMCA strategic plan include to continue developing a unified, consistent, and progressive Oakland County EMS system, leverage OCMCA resources to mitigate inefficiencies and diminishing resources as healthcare changes and hospitalization is de-emphasized, and foster an environment of excellence by standardizing education and continue implementing QA/QI processes while exploring new science. The EMS Quality Improvement Program, or EQIP, is the primary tool that facilitates the OCMCA strategic plan objectives. Per the state law, the OCMCA is responsible for verification of skills and knowledge for their EMS providers. To that end, EQIP is designed to provide direction to our EMS agencies with respect to quality improvement and verification of skills and knowledge. Since 2015, EQIP has provided a uniform, standardized, systematic, and responsible quality improvement program through education and OCMCA support. EQIP can be broken down into three primary components that all OCMCA LSAs are responsible for. These include required data reporting, a skill and knowledge verification process, and measurement of protocol knowledge. The OCMCA collects quarterly data from its LSAs. This process includes various data reporting elements such as EMS run volume data, patient care destination data for transporting life support agencies only, CARES data, and any requested study data as needed. Every year, starting in January, the OCMCA facilitates a process designed to identify its necessary education objectives and initiatives for the following year. The purpose is to foster an honest, reasonable, and accountable environment of sustaining our strengths as well as improving upon our weaknesses. During this process, the Oakland County Med Control provides information and evidence to the Professional Standards Review Organization, or PSRO committee, that focuses on three primary considerations. These considerations are used by PSRO to determine the need for required EQIP education components. The three considerations include the importance of evidence-based education, the importance of interest and relevance, and the cost of EQIP education development and deployment. The OCMCA requires that each EMS provider complete specific knowledge assessments to assure retention of education and protocol knowledge compliance. At a minimum, all OCMCA EMS providers that respond to or are expected to respond to EMS calls must successfully complete the annual Michigan EMS Protocols Assessment. In addition, EMS providers are assigned additional knowledge assessments based on the required education components that were assigned that year. OCMCA.org/EQIP is the dedicated webpage that contains all 2021 EQIP details, documents, and forms. All documents and forms referenced in this video are available here for download. This year, we've made all 2021 EQIP information public on the website. Please share this information with your agency EMS providers. The 2021 EQIP data reporting forms and education verification forms can only be accessed after logging in to the password-protected section. Each LSA has one person that has a login and a password. In addition, this area serves as the location to access your LSA's annual letters of compliance. Contact the OCMCA by email at ocmca.org if your LSA is having trouble logging in to the password-protected section of the EQIP website. The 2021 EQIP plan is expressed on a one-page document that clearly lays out all 2021 data reporting, education, and knowledge assessment requirements. This convenient resource, as well as all other documents referenced in this video, are available for download at ocmca.org/EQIP. This year, all OCMCA life support agencies will continue to complete an EQIP data report after the end of each quarter. Each LSA must submit a data report no later than the 15th day after the end of a quarter. Each LSA must have one person that submits quarterly EQIP data reports. All agencies have a username and password that will provide them with access to the EQIP section, which allows them to complete the reports. Again, contact the OCMCA by email if you're having trouble accessing this section of the website. Once you're logged in, the 2021 EQIP data reporting form will require each agency to enter in specific data elements. First, the LSA is required to input some basic demographic information from drop-down menus. This includes the name of the LSA type, meaning whether they are municipal or a private agency, the LSA license level, and the LSA transport status, which indicates if they are a transport or non-transport agency. Next, they will enter the total number of EMS patient care reports that were generated during the reporting period. Specifically, each LSA will be required to provide the total number of EMS PCRs to which the OCMCA has been selected as the responsible MCA that were generated during the reporting period. This includes all emergency and non-emergency EMS incidents and patients, ambulance interfacility transfers, patient refusals, and other patient contact. This excludes fire suppression-related activities that did not include patient contact or care and/or law enforcement-related activities that did not include patient contact or care. Each LSA that is licensed to transport is required to complete the Patient Destination Data Section 2. This field will only appear if your agency is licensed to transport. Specifically, each transporting agency will complete the patient destination report by inputting the total number of transports to each individual hospital that occurred during the reporting period. This includes the transport of any patient to any unit, area, or other location of a hospital that generated an EMS patient care report, to which the OCMCA has been selected as the responsible MCA. The OCMCA will not collect cardiac arrest PCRs in 2021. However, they do require each LSA to continue to submit data to CARES on a monthly basis. The Cardiac Arrest Registry to Enhance Survival, or CARES, is a cardiac arrest database that was developed to help communities determine standard outcome measures for out-of-hospital cardiac arrest locally, allowing for quality improvement efforts and benchmarking capability to improve care and increase survival. Every Oakland County LSA must have a CARES representative who is responsible for entering the agency's cardiac arrest cases each month into CARES. Please assure that your LSA continues to submit their CARES data so that we have the most up-to-date and accurate information. For questions about CARES and submitting data, contact Terry Shields, the Save My Heart Executive Director and State of Michigan CARES Coordinator. She's awesome. The MyEMSIS Data Compliance Initiative began in 2020 to improve OCMCA, Life Support Agency data submission compliance to the Michigan EMS Information System, or MyEMSIS. Every Monday, each Oakland County Life Support Agency receives a report via email that provides details regarding the patient care reports that their life support agency uploaded to MyEMSIS in the previous week. Throughout 2021, each Oakland County agency is required to maintain a PCR data submission to between 90 and 110%. The OCMCA PSRO Committee will perform a quarterly MyEMSIS compliance review. Any agency that fails to maintain a PCR data compliance submission between 90 and 110% will receive notification from the PSRO Committee, along with a request for an explanation. This may result in your agency being invited to attend PSRO to discuss your LSA's noncompliance with the initiative. You probably have a few questions. The first is likely, who will be emailing these reports to my life support agency? Well, our good buddy Justin Allen at the Michigan Department of Health and Human Services will be assisting the OCMCA with this initiative. Please contact Justin with any questions about your weekly report. Next, you're probably wondering who at your LSA will receive these reports. The person or people listed in your LSA's MyEMSIS account will receive the weekly reports. Finally, you may be wondering if these reports can be sent to multiple people at my agency. The answer is yes. Log into your agency's MyEMSIS account and add email addresses to the contact list. Each person listed will receive the weekly report. In 2021, all Oakland County Med-Control EMS providers of all license levels must complete 4 education modules that focus on EMS patient care reporting. As stated earlier, Oakland County Med-Control focuses on 3 primary considerations when selecting EQIP education topics. These include the importance of evidence-based education, the importance of interest and relevance, and the cost of education development. Oakland County Medical Control Authority has designed 4 modules that focus on EMS patient care reporting. The titles of each of these modules will give you a good idea about the intent and purpose of each. MedControl has produced sufficient resources to assist LSAs with the completion of the 2021 education requirements. The education will be available by March 1, 2021, and offered in multiple formats. All 4 module lesson plans, instructor guides, and PowerPoints will be available in the OCMCA Digital CE sponsorship. Life Support Agency instructors can use this resource to provide the education in the live teaching environment. If you do not currently have access to the OCMCA Digital CE sponsorship, contact Robin by email at ems@ocmca.org. Another option available to our EMS agencies and providers is completing 25 to 30-minute American CME video versions of the required training at americancme.com. Each OCMCA agency already has an agency account at americancme.com, and each EMS provider should also have a user account associated with their agency. Contact American CME by email at americancme@americancme.com if you or your LSA are experiencing problems with your agency or EMS provider accounts. This video will also be made available for download at ocmca.org/equip. Each life support agency must assure that 90% or greater of their EMS personnel of all license levels complete all EQIP education requirements. Each LSA is required to complete and submit a 2021 EQIP education verification form for each required module. To complete each form, go to ocmca.org/equip and log into the password protected section. This section allows the agency to complete and submit the verification forms. Again, contact the OCMCA if you're having trouble accessing the password protected section. The forms will require the agency to report the total number of EMS providers at their agency. Then, the LSA will input the total number of EMS personnel that were able to actually complete each EQIP education module. An additional text box will automatically appear if your agency did not complete the education with 100% of the applicable EMS personnel. When this occurs, you must describe why less than 100% of your personnel did not complete the required education. This is the LSA's opportunity to express the circumstances that prohibited your LSA from completing the education requirements. The Oakland County Medical Control Authority encourages all agencies and their EMS personnel to provide continuous and honest feedback regarding all med control education initiatives. Specifically, the LSA must answer the following questions on each education verification form. First, were the education resources adequate to complete the education requirements? Was the allotted time adequate to complete the associated requirements? And finally, LSAs can enter in any comments or feedback into the form if needed. All 4 2021 EQIP education forms are located at ocmca.org/equip, and they are all due October 31, 2021. Again, contact Robin at ems@ocmca.org if your LSA requires assistance with accessing this section of the website. As stated previously, the OCMCA requires that each EMS provider complete specific knowledge assessments to assure retention of education and protocol knowledge compliance. At a minimum, all EMS providers of all license levels must successfully complete the annual EMS Protocols Assessment. In addition, EMS providers are assigned additional knowledge assessments based on the required education components that were assigned that year. In 2021, each LSA must assure that a minimum of 90% of their EMS personnel complete the 2021 Michigan EMS Protocols Assessment and the 2021 EMS Patient Care Reporting Assessment. In addition, all LSAs that carry BEES kits must assure that 100% of their EMT basics and applicable medical first responders complete a 2021 BEES assessment. Any EMS provider that fails to successfully complete the BEES assessment, as listed here, will be required to complete the entire BEES in-service training program. There is no completion reporting process for the 2021 knowledge assessments. Oakland County Med Control can run the necessary reports directly from the American CME website. The only thing LSAs must do is review their agency and user accounts to make sure that all of their EMS personnel appear on their American CME agency roster. Again, contact American CME by email at americancme@americancme.com with any questions about your agency and user accounts. In 2021, the Oakland County Med Control continues to facilitate many voluntary programs and special studies designed to improve the quality of our EMS system. Multiple successful Med Control programs will continue in 2021, which include the Bees Kit program and the MFR Glucometer program, which are both voluntary. As you're likely aware, all licensed BLS units in Michigan must carry epi auto-injectors. Bees started out as a special study that allowed basic EMTs to draw up and administer epinephrine 1 milligram per milliliter instead of an epi auto-injector. The initial idea behind the study was to decrease the cost of stocking epi auto-injectors while also assuring that the EMS provider can adequately and safely administer the life-saving medication. This program applies to LSAs that have at least one state-licensed MFR or BLS unit. After being wildly successful in its first 2 years, this study has expanded to include medical first responders and is now a standing program for eligible life support agencies. To continue your LSA's participation in this voluntary program or to add your LSA, complete the 2021 OCMCA Voluntary Programs and Special Studies Participation Form found at ocmca.org/EQIP and email it to qi@ocmca.org by March 1, 2021. The OCMCA will respond with additional information. Agencies that are new to this program must complete required training with their EMT basics and medical first responders. This training is not mandatory for paramedics at participating LSAs. The MFR Glucometer program applies to LSAs that have at least one licensed MFR unit. There are many areas throughout Oakland County, Michigan, where a MFR will initiate patient care, complete an assessment, and render care for a period of time before the arrival of a BLS or ALS crew. This program allows medical first responders to go above their scope of practice after completing very specific training and use glucometers stocked on their MFR units. This program has been very successful with our MFR agencies. To continue your agency's participation in this voluntary program or to add your agency, complete the 2021 OCMCA Voluntary Programs and Special Studies Participation Form found at ocmca.org/EQIP and email it by March 1, 2021. We will respond with additional information. Agencies that are new to the program must complete required training with their MFRs. In 2021, Oakland County Med Control will hopefully introduce one new program as well. Carter Kit's sensory bags contain items known to comfort and appropriately focus children who are on the autism spectrum. Go to carterkits.com for more information about this product. The OCMCA, MDHHS, EMS for Children, and Oakland County Health have collaborated to submit a grant to obtain Carter Kits for every licensed EMS unit with OCMCA privileges. If awarded the grant funding, there will be no initial or ongoing cost to the LSA or the OCMCA. Sufficient education resources will be produced to facilitate the success of this program. The grant awards will be announced May 2021. The OCMCA will provide additional information after the grant award process. Agencies must complete the required training if the Med Control is awarded the grant funding. But don't worry, ample resources and information will be provided well in advance. Multiple Oakland County Med Control special studies will continue in 2021. This includes the annual cardiac arrest study, the community paramedicine studies, and the stroke systems of care special study. In 2021, we will not collect cardiac arrest patient care reports. However, the OCMCA requires that each LSA continue to submit monthly CARES data. The Cardiac Arrest Registry to Enhance Survival, or CARES, is a cardiac arrest database that was developed to help communities determine standard outcome measures for out-of-hospital cardiac arrest locally, allowing for quality improvement efforts and benchmarking capability to improve care and increase survival. Each LSA must have a CARES representative who is responsible for entering the LSA's cardiac arrest cases into CARES each month. Please assure that your agency continues to submit their CARES data so that we have the most up-to-date and accurate information. For questions about CARES and submitting data, contact Terry Shields, the Save My Heart Executive Director and State of Michigan CARES Coordinator. She rocks. Community paramedicine is a term used to describe programs that are designed to use train EMS providers to help bridge the gaps in local healthcare systems and improve population health and safety. Community paramedicine programs continue to grow statewide and throughout the nation. The current programs in Oakland County include the Remote Specialized Visiting Physician, or RSVP, with St. Joseph Mercy Oakland Hospital, Bloomfield Township Fire Department, and Star EMS. Both RSVP community paramedicine special studies are designed to target vulnerable, chronically ill, and underserved residents by providing provider outreach via secured video conferencing equipment and utilizing their frontline paramedics' expertise without the necessity of travel and wait times typically seen at local urgent cares, physician offices, or emergency departments. The objective is to reduce unnecessary costs due to emergency department visits, transports, hospitalizations, and readmission rates, while assisting residents in their transition to home recovery. To continue your agency's participation in this voluntary special study or to add your LSA, complete the 2021 OCMCA Voluntary Programs and Special Studies Participation Form found at ocmca.org/equip and email it by March 1, 2021. We will respond with additional information and requirements. The Oakland County Medical Control Authority Stroke Systems of Care Special Study began in 2018. In a nutshell, the MedControl is measuring how accurate our EMS personnel are at measuring strokes using FAST-ED, which is a validated stroke severity scale. The OCMCA has produced all necessary education and training resources to enter the study. To continue your LSA's participation in this voluntary special study, or to add your agency, please complete the 2021 OCMCA Voluntary Programs and Special Studies Participation Form and email it by March 1, 2021. We will respond with additional information and requirements. In addition, visit ocmca.org/stroke for more details about the Stroke Systems of Care Special Study. There, you can find all the information about the education and data requirements. The OCMCA will be introducing multiple new studies in 2021. These include ET3, ECOMS, and the Ketamine Special Study. The Center for Medicare and Medicaid Innovations Emergency Triage, Treat, and Transport, or ET3 model, is a voluntary 5-year payment model that will provide greater flexibility to ambulance suppliers to address emergency health care needs of Medicare beneficiaries following a 911 call when an ALS unit responds. Under the ET3 model, the Centers for Medicare and Medicaid Services will pay participating agencies and providers to transport an individual to a hospital emergency department, treat the patient on scene, or transport them to an alternate destination. In 2020, the Oakland County MedControl worked with multiple LSAs and hospitals to prepare for implementation of the special study in 2021. If your agency would like to participate in this voluntary special study, complete the 2021 OCMCA Voluntary Programs and Special Studies Participation Form and email it in by March 1. The Electronic Communications, or ECOMS Special Study, is designed to investigate the use of a state-of-the-art electronic communications system that is capable of the ability to facilitate messaging, audio, and/or video communication between EMS and the ED, as well as maintain all HIPAA compliance measures. The OCMCA has selected a telemedicine application called eBridge as the interventional tool for this special study. Essentially, EMS providers will use eBridge to facilitate pre-arrival notifications from EMS units to receiving hospitals. That means you'll use this app to contact the hospital and let them know you're on the way with a patient. This application offers several features, including live video streaming and voice and text communication. It is also capable of EMS tracking with live ETA and specialized burn, STEMI, stroke, sepsis, and trauma functions. they can pretty much make anything we want them to. GD's eBridge also offers seamless integration into CarePoint, which is used by many OCMCA hospitals to receive EMS communications. eBridge will work on pretty much any tablet, smartphone, or laptop, but it will not work on Apple computers. But eBridge will work on Apple iOS devices, such as the iPad and iPhone. Again, if you want to participate in this voluntary special study, complete the 2021 OCMCA Voluntary Programs and Special Studies Participation Form. Email it on in by March 1, 2021. We'll respond with additional information and requirements. In 2020, the Southeast Michigan Regional Drug Box was finally stocked with ketamine. In 2021, the OCMCA will conduct a special study to measure and evaluate the use of ketamine since its introduction into our EMS system. The related data, outcomes, and information will be made available to all Oakland County Med Control Life Support agencies through various education assets. EMS providers should continue to use ketamine per protocol. There are no other requirements for this special study. This concludes your 2021 Oakland County Medical Control Authority EMS Quality Improvement Program in service. Please contact the OCMCA with any questions by email at qi@ocmca.org or by phone at 248-975-9704. Thank you and have a great day.